Mesothelioma is a disease associated with asbestos exposure. It generally occurs about 40 years after the first exposure to asbestos in workers. It is a disease of the lining of the lung and the lining of the inner chest wall. In the late 90s in Zurich, we developed a treatment which is a combination of chemotherapy followed by surgery. Surgery is extrapleural pneumonectomy, that is a surgery taking away the lung with the tumor around it and taking away the lining of the chest wall, taking away the diaphragm and part of the pericardium. It's a very radical surgery. But radical surgery for cancer generally means you have a safety margin. Of course, this cannot be done in a tumor on the chest wall because you cannot take away the chest wall. And this is the reason why even after radical surgery, very often there is a relapse in the same area. Now the question we posed in this study, would a combined treatment of chemotherapy, radical surgery, and hemithoracic radiotherapy prevent the local relapse that we've seen before, or at least delay the relapse? This was the concept of the study. We had 151 patients who agreed to enter this study, and you see that in 96 of those 151 patients, a radical surgery was possible after chemotherapy. So two-thirds of the patients were available to have a radical surgery for this disease. Now, these are the patients we looked at in a randomized fashion. What was the role of hemithoracic radiotherapy? And here you do see the results. So this is the relapse-free survival with patients treated with surgery alone, which is in black, and the relapse-free survival of hemithoracic radiotherapy. And to our disappointment, there was no significant improvement, and we were thinking of an improvement of at least 6 months to be worthwhile. This is the case because mesothelioma is a dreadful disease with a survival time when you can do combined chemotherapy and surgery approaching 20 months. Now, with these 20 months, the patient have undergo 6 months of treatment, so it's a very heavy burden of treatment. And the question is now, from where we stand, how do we make it worthwhile for the future? What would be the right approach? So I want to conclude that hemithoracic radiotherapy after radical surgery is not successful in bringing a benefit. So what will be the next steps? And the next steps are very clearly, we have really pushed the treatment, maximized the treatment with all conventional mean chemotherapy, surgery, and radiotherapy, and we had not been successful to further improve. So currently, what the concept is to go steps back. Instead of doing radical surgery, lung-sparing surgery is performed, and we can show that is almost as good as the radical surgery. There are investigations of applying after surgery the chemotherapy locally in the chest wall, and there are investigations on targeted treatment in mesothelioma as the focal kinase inhibitor. And I think this fits nicely in with the previous presentations. There's also hope, and there's some good signals that immunotherapy with immune checkpoint inhibitors will be the next step. Thank you.